Reminder, reminder, reminder. The Delta State Contributory Health Commission wish to remind all pregnant women residing in Delta State to register into the scheme and get a health card. All children under 5 years must also be registered and get a health card before attending hospital. No health card, no free treatment. No health card, no free antenatal. No health card, no free delivery. This message is brought to you by the Delta State Contributory Health Commission.
Hello, thank you so much for joining us on the program, Delta Health Insurance Scheme and you. To kickstart this week's episode, let us bring you a news update on the recent activity of the Commission, after which we'll take a short break and we'll serve you our main dish for today. So please stay tuned. I will be right back.
Delta State Contributory Health Commission. Ofrikaye kaye rodi efurubotore Delta. Ereso de bi oto rowo le ye bi oyibo se health card. Emo ye gbukuyan ipoto. IT so de bi oto raibo le ye bi oyibo se health card na. Laise wo pe asare disi won ma. Obi be bi oyibo se health card na. O mesi wo be oiro. Obi be oyibo se health card na. Eru wo te wo de mrefu. Ofe oiro. Obi be oyibo se health card na. Wo de kevie. Ofe oiro. Yana boy Delta State Contributory Health Commission.
Medical laboratory practitioners in health facilities under the Delta State Contributory Health Scheme have been warned to stop collecting charges from in-release of the scheme for laboratory tests. The Director General and Chief Executive Officer of the Delta State Contributory Health Commission, Dr. Isaac Akpoveta, during an intensive training program he organized for laboratory scientists drawn from health facilities registered with the Commission across the state. Speaking at the Commission's headquarters in Asaba, the Delta State capital, Dr. Akpoveta pointed out the majority of the laboratory tests required by enrollees were already covered under the state's contributory health scheme, and there was no justification for charging enrollees for tests that had already been paid for by the Commission. He said enrollees are not expected to pay for tests such as ultrasound tests, PCV, full blood count, urine tests, x-rays, among others, pointing out that some of the tests were covered in the capitation paid by the Commission, while any tests not covered in the capitation carried out on any patient were refunded to the health facility. The DG frowned at the way matrons turned primary healthcare centers into private businesses, extorting monies for drugs from patients instead of requesting drugs from the Delta State Drug Revolving Fund DRF and warned them to desist. He reiterated that the Commission would take disciplinary action against practitioners or facilities found violating the scheme's guidelines, emphasizing that such illegal acts placed on patients the burden of out-of-pocket medical expenses, which the Commission was combating. Dr. Akpoveta urged medical professionals to cooperate with the Commission in ensuring the efforts of Governor Sheriff Oborowori in promoting the health of Deltans yielded more fruits.
These enrollees are indigent people, they are vulnerable people that cannot afford care in the first instance, and that's why the government provided this access to care, financial access to care for them, and that's why government is paying so much money on their behalf. You are aware that recently His Excellency the Governor, Right Honorable Sheriff Oborowori, released 1.6 billion, and we paid them this bond on behalf of their release. So how do you now charge them again? Collect money from them, send them to outside laboratory where they spend money, borrow money to pay. It's got very painful to me, but very disheartening, and I had to invite them.
Dr. Isaac Akpoveta had trained the participants on topics ranging from billing protocol, ethical medical practices, and the role of health workers in the success of the contributory health program. Eunice Emiazia reporting.
Zone 2, Ebigberiye, Nakmagba na Modiaye, Totuka Beriko Mabalabana, Membelaba, Delta State Contributory Health Commission Akerikom, Egberi Batragaboma, O Kelemo Komo, from Brumere, from Brumere, it no frame Kimasa, Mna dent was our Akmu, and I get about Funkuapa, and I most he can refuse a common number, Fuma Maraba, Manipulated Zide, by a back by a Coafi, Bandy or Border Barbara, Mam can make Bilme. I yapper ye, yapper zero from now, or Kakam 9 10 to our I get him Gapanaka, O say a part, to bomb, Brevafum, Berescom, Amusa Gagat bomb, Zora Cane, and you book up in book one fight. The Brahman Brahman, no other Brahman Okakum, I get Mongapai, Nakma Bana, but Jay, a hill like Billy, McBilma Brapo too, and egg Barman Brava. Delta said on the wooden elk come to Brapo. Let me don't ado.
Yes, of course, you know my name, Honorable Dr. Isaac Akweleta, DG of the Contributor Health Commission. Today is an interactive session with pharmacists with laboratory scientists across the state in all facilities accredited by the scheme. It's as a result of complaints received from the field about the way they were treating release, collecting money from those who are even registered into the scheme, who were paid in advance for, paid advance capitation to all hospitals in millions. There is no more, don't pay close to 200 million as capitation. And yet they will go to hospital, they already go to hospital, and the hospital will charge them. And then the laboratories. And so we realized that probably to do a dialogue with them, interact with them, train them on the principle of health insurance. The truth is that health insurance was not taught in medical school, in polytechnic, anywhere. They are not being taught. And so there's a lot of ignorance. Of course, apart from that, there's also a lot of attempt to make quick money from the system. So we invited all the laboratory scientists, laboratory technicians across the whole state. We are moving from Central District to Central District to make sure that we cover everyone. Today we have talked extensively about the role of the lab scientist in health insurance care. And we're very glad that we've opened their eyes to the concept, the difference between the general laboratory care for the general population and care of the release in health insurance by the laboratory scientists. And so today's mission was to educate the laboratory scientists to ensure that they don't collect money from enrolled members of the scheme. And at the end of the talk, you can see how excited they were, and they agreed that yes, they will try to control that. But they did mention the fact that there is this drive for IGR by the hospitals. And so it looked like they were giving targets to meet, and they don't care who they're trying to give all those targets. But after today's talk, during which we made them to realize that these enrollees are indigent people, they are vulnerable people that cannot afford care in the first instance. And that's why the government provided this access to care, financial access to care for them. And that's why government is paying so much money on their behalf. And therefore charging them is like double punishment. And I think they've understood that, and they've agreed that they will ensure that those who don't need to pay must not pay. And I hope, and also wonder about the consequences of breaching that law. It's a policy in the operational guideline in the law of the scheme that enrollees are not to pay, because government must pay money in advance. You are aware that recently His Excellency the Governor, Right Honorable Sheriff Oborevwori, released 1.6 billion, and we pay them this bond on behalf of the enrollees. So how do you now charge them again? Collect money from them, send them to outside laboratory where they spend money, borrow money to pay. It's got very painful to me, but very disheartening, and I had to invite them for discussion. And from the outcome of discussion, it was clear: one, there's ignorance; two, there is this urge for IGR by our government hospitals. This should stop. Government does not build hospitals to make profit, cash profit. The profit of government in any walks of life is the smile on the face of people. Government build roads. They don't make any money, don't toll the roads and make profit. But they are happy that people riding the road are happy that the road are smooth, safe, and easy to get to where you're going. So also is healthcare. Healthcare government spend billions, even more than the money they spend on roads. And the purpose of that is to ensure that the common man in particular, 80% of indigent people that cannot afford to good quality healthcare, receive care, and they smile, even at a lost profit for a government. Government doesn't look for cash. The smile on the face of people is what Sheriff wanted. Because Sheriff cares. Sheriff cares for the people. I can assure you, I can confirm that to you. But don't make it look like he's not caring. So we've talked to, it's not really a laboratory. We went around the entrance recently to all the facilities across the state. And what I saw patients will be charged. After charging them, they pay and they send the bill to the commission all over again. I'm telling you, it's very disheartening. Since that time, they've been doing reform. Most of the hospitals are quickly reforming. Munkai said, I'm going to report them. And so they are making reforms. And I think it should stop. This one should be a medium for all hospital MDs, ZM, CMDs to talk to their staff to stop collecting money from patients. Government has paid for those he has that are registered in the scheme. Unless you are rich enough, you didn't register in the scheme, you can go and pay. But once we have registered and have our health card or our slip, or we have a list sent to you and Captain paid in advance for that patient, please, CMD, talk to your people not to collect money from them. This is why we call this meeting today, to discuss with the lab sector. We're also going to do that with some other sector hospitals to ensure that they stop billing patients that have already been paid for or who have already paid for their health insurance. They are entitled to all tests except few. For example, they are entitled to PCV, whether you are short of blood or not, full blood count, whether you have blood infection, urine test, culture, all of them. Some of them, they don't need to send bill to everyone, we paid in advance. Some of them, they need to inform us they want to do this x-ray. We approve it for them to do it, and then we send the bill to us. So they shouldn't send the patient out. X-ray is covered. X-ray is covered, but it's not covered just like that. It is when the doctor feels that you need to do x-ray, he requests for a code, we give the code, and then they will do the test. If you send the patient out, send money to pay for that laboratory outside. Don't ask the patient to pay, because we send the bill to us, we refund you the money. So virtually almost all tests are covered. Few tests are not covered. For those who are covered, some of them you don't need to send bill. It's covered in capitation. Some of them you need to request for a code, and they'll give you code, you do the test and send it to us. Ultrasound, for example, is free. For pregnant women, ultrasound is free. For the ordinary person that is registered in the scheme, that is having abdominal pain, for example, if we need to do ultrasound, he will pay. But he doesn't pay from his pocket. We will pay on his behalf. Do the scan, send the result, test to us, we will pay. So in all, the patient is not paying. He said that money has been advanced for his brain test, or you request for a code so that you can do the test, and then we'll pay you the money later.
An example is something I found out in the community. There's a health center there in that community. People go there to take maybe malaria drugs and all of that. But I noticed that they will ask them to pay. So I was asking a question, and they said that their own is not involved in it. I said no. What I learned was that all government hospitals and primary health care centers are under the scheme. So why are you not asking these people to pay? And they tell them, they charge them as if it's a private hospital. So I would want you to reiterate that, especially those rural areas where they're exploiting citizens.
Yeah, there is a deliberate attempt by primary health care centers being run by matrons, they've turned it into their own private business. They will go and buy drug themselves, dispense to the patient, and charge the patient instead of requesting for drug from DRF. Recently, I have to contact DRF that why is it that it's not supplying drug to primary healthcare centers to be used. Our agent on the field reported that the primary healthcare centers are not requesting for drugs, and so there's no activities, or when there's activity, they charge the patients to pay. It's deliberate. Now, DRF said they don't request. Because I sent physical examples to him that so health center is not having drugs. He said they didn't request. And he now wrote an official letter to all primary care centers and government hospitals that you must make requests early enough. Within 2 weeks, we will supply you the drugs. And when the drug gets to them, use it to treat them. But it's deliberate. I'll tell you a small story. I went to Kwale and I invited all primary care centers to come. We discussed. Some said, oh, we don't want to be in the scheme again. And I said, why? He said, no, the other clinic, health center is not in the scheme. I built a house. Because he's charging patients and collecting money. So because of that, we brought almost all primary care centers into the scheme to reduce these out-of-pocket charges. So it's a peculiar problem. We have invited the primary care center OICs for meetings severally. They've given excuses. Yes, excuses that, oh, we have a training something, we have a program here. 2 times that they've broken down, they didn't attend the meeting, but we're going to force it on them to warn them, to educate them on the need to request for drug from DRF and treat our patient free. And so that one is a backyard business, in quotes, where they make money for themselves. Sometimes we even supply them drugs. We'll be surprised that we'll keep the DRF drug at the corner and start dispensing their personal drug and collecting money, claiming that they will not supply it. So there is a lot of undercutting in the system, but fraud in health insurance is a national problem. Well, of course, we are aware recently that NHIS have sanctioned many hospitals and delisted some hospitals for fraud, including the HMOs, because of fraud. So fraud is very prevalent in health insurance, and that's why we're doing everything we can do. We introduce so many measures: facial encounter system, bundle payment, pre-capitation with monitoring. We put ours out there, SQM, service quality monitors. We call them agents who monitor the prescriptions dispensed to the patient. To the extent that when the pharmacists will dispense half of the drug prescribed by the doctor. Instead of 30 days refill for hypertension, they will fill drugs only for 15 days, even for 10 days. You can't imagine it. And when you ask them, is IGR dry? So I think we need to come, and I want the press to come into this matter, and let us see how we can encourage our people to obey the simple rules of health insurance as enunciated by government through this commission.
Something about having their own hospitals or specialized units. Okay. Because some hospitals are heavily patronized by the population. If you go to Ughelli Central Hospital, by 8 o'clock, you see a crowd of about 200 people sitting down to see 1 or 2 doctors. It's not possible because the doctor can spend about 30 minutes per patient. And so, how many people will the doctor see in a day? Probably 16. And out of 200, so people go to hospital as early as 8 o'clock in the morning, sometimes 5 o'clock in the morning to take a number, and they will not see doctor until 2 in the afternoon. And so, if you move the health insurance release into such a group, of course, they won't see it, they won't see the doctor. So we are advising that every big hospital to have a health insurance unit dedicated to health insurance and release. So when you arrive in the hospital, you don't need to go and join that general crowd. You go to the health insurance unit,
where a doctor are dedicated to the scheme, a nurse, a pharmacist, a laboratory scientist, a ICT person, all of them in a small unit, quickly attend to the patients, prescribe for them, give them their drugs, and let them go. We cannot put health insurance and release in the crowd of people that will be attended to in 3-4 hours after waiting for. It's like what happened in the bank those days. In bank those days, you go to bank, queue, a long queue to collect money. Until the bank came out with POS, with the ATM, with even transfer in your phone. So there's no more queues in the banks anymore. So we want to create a situation where we can do that kind of micromanaging of our release to reduce them from the suffering of long queue and waiting. So we are introducing health insurance unit in all the hospitals. Her Excellency, the wife of governor, is a mother of the state, the first mother, and was worried about mother-child transmission of hepatitis. And we had a discussion that we need to see that we can discuss this early enough, take precautions and preventive measures to reduce transmission to the child. And so we adopted it, and then we do our thing. And so for more than Deltas is the only state in the federation where hepatitis is compulsorily tested in all pregnant women, courtesy of Her Excellency interest. She has the matter, even unborn child matters. And because that unborn child is the future of Nigeria, the future of Delta State, we must protect that child even before the child is born. We cannot afford to bring children in with HIV, with hepatitis, even before they arrive, they already have a burden on their life. So Her Excellency introduced that, and we took it up as part of our benefit package, and it is being done across the states.
Anga retí òwòwò ọ̀fọ̀ pàtàkì wé anga toka torogo ní àrùnṣẹ́ ara níní takápẹ̀wé Contributory Health Commission gin bọ̀tọ̀jáwé gin ebirin dédé tó gbè fún nẹ́rì dẹ́ta ẹ̀nẹ̀wé gídàrẹ́wẹ̀ gbàgbé ìwé anga aka gin kẹ́ngin ọmọ dédé tó wí ọ̀dọ́ márùn gbà toalẹ̀ agin kẹ́ngin dáńdédé rẹ́wẹ̀ gbàgbé wọn. Agitori gin rata erewe gbagbe wa amari uliewo yibo ayin wa beju to an aka gin kengin ebiren dede to gbe fun rata eriwe anga ayin wa beju to anga rata eriwe anga ayin wa shwe fun anga rata eriwa ama fe bi e wa sofe wo ma magin wo so lobire to wi ere ni data we Dumunegbárigin wórègbàgbé ìwé rẹ̀ ọ̀fọ̀wé Contributory Healthcare Commission òun iná mú wá.
That's how we conclude this week's episode of the program, Delta Health Insurance Scheme, and you. Join us again next week, same time, for a fresh package. I am Eunice Emezia. Remain blessed.
The Delta State Contributory Health Commission, they don't come again to remind all pregnant women when they for inside Delta State to say may they go register with the Delta State Contributory Health Commission scheme and get their health card. Even all pikin when they for 0 to 5 years must also register and get their health card before they go get any kind of treatment for our hospital. Because from now on, it go be say no health card, no free treatment, no health card, no free antenatal, no health card, no free delivery. Now the Delta State Contributory Health Commission, now they bring on this ogbonge tori o.